Hi, I'm Dr. George Woodbury, a dermatologist with Rheumatology and Dermatology in Cordova, Tennessee for the last over 28 years. This video will look at our practice philosophy, give you a chance to meet our doctors, and look at how to have a super visit with us here in Cordova. Click on the subscribe button to gain access to future videos with Rheumatology and Dermatology.
Hi, welcome to Rheumatology and Dermatology Associates. Here at our clinic, we treat arthritis, joint pain, and various other underlying conditions for rheumatology. Our dermatology side treats skin, hair, and nail issues. We are located at 8143 Walnut Grove Road in Cordova. The office hours are Monday through Friday, 7:30 to 4. Our doctors are Dr. Kathy Chapman, Rheumatology, Dr. Linda Myers, Pediatric Rheumatology, and Dr. George Woodbury, Dermatology. We accept most commercial insurances. For a specific question about your insurance or any other questions you would have, please call our office at 901-753-0168 and hit option 4 for appointments.
New patients will be required to bring their driver's license or state ID and insurance card. Our new patient paperwork can be found on our website at rheumderm.com under patient forms.
Our motto is healthy skin and joints for the whole family.
Hello, I'm Dr. Linda Myers, and I'm a pediatric rheumatologist. And I have been practicing in Memphis for more than 30 years and now have moved to a new location in Cordova. I did my medical school at University of Tennessee in Memphis, did pediatric residency in St. Louis at St. Louis Children's Hospital, and then did training in pediatric rheumatology in Dallas, Texas at Texas Southwestern. I have expertise in diseases like juvenile arthritis and lupus and scleroderma and rheumatic fever, and am interested in a broad number of connective tissue type diseases. I have also been awarded a master at the American College of Rheumatology, so I'm looking forward to seeing new patients at this practice. Hello, I'm Dr. Myers, and I'm so glad you came as a new patient to my practice. And I want to tell you a little bit about what coming to my practice is like. Usually we'll get a referral from your pediatrician, and I'll ask you to bring records of work that's been done there, lab work and x-rays. And then you'll come here, and usually we'll sit and talk for a few minutes and find out a little bit about your symptoms, how you've been feeling, and what kind of problems you've been having. And then when we finish that, I'll have you sit on the table and we'll do an exam. And I'll show you a little bit of what that's like. Usually we get a light and I'll shine it in your eyes and in your mouth. Open your mouth. And then we do an exam, and that includes a joint exam. So I'll show you what that's like. We'll move you around. See how you move. The other side. I'll ask you if you hurt or have any pain or if you have any swelling. Squeeze my fingers. Okay, very good. So then when we finish the exam, then often we'll do blood work, and that's done in this office, and sometimes we do x-rays. And then after that, we're finished. We'll often talk to you about what medications you might start, and we send a letter to your doctor. We appreciate you coming to our office in Cordova.
My name is Dr. Kathy Chapman, and I'm a board-certified rheumatologist in Memphis, Tennessee. I've been a rheumatologist for 29 years and in practice here in Memphis for 27 years. I take care of adults with arthritis and immune system disorders, and I've been doing that in my private office for that period of time. I trained in Rochester, New York for rheumatology and then moved here to Memphis and have been actively involved in the care of people that have diseases like rheumatoid arthritis or lupus. There are many treatments we now have that can be very helpful. The key to diagnosing these conditions is often finding out what symptoms are going on and doing a physical exam and lab work as well. It's very helpful to the physician, for me and other physicians, if patients make sure that they bring in medical records if they have any, or past laboratories, or other treatments they may have had in the past. What we really aim for here is to help improve people's function, decrease their pain, and hopefully maintain a very active lifestyle. A lot of the conditions I treat are chronic, which means they will continue, but there's a lot we can do in terms of making people able to do well with their diseases, and that's what I do, and that's what my goal is, to get you, and if you have family members, feeling better. We're going to go ahead and do a physical exam, and afterwards we'll go ahead and sit on back down by the desk and we'll talk about what we can do and get you hopefully feeling better soon. Let me take a look at your hands here first of all. Now let me know if it hurts anywhere.
Okay.
As I poke around, I'm feeling for any swelling or if there's any tenderness or warmth in the joints. Okay, good. Can you reach up? And then up behind you? Wonderful. Okay, let me have you bring that back around. Maybe you put your chin to your chest and then look up. Or have you look at me, turn your head to the right, then all the way to the left. Back at me, ear down to your shoulder, and back the other way. Okay. Alrighty, good. Now I'm going to go ahead and listen to your lungs. Let me have you take some nice big breaths through your mouth.
Okay.
Alright, let me have you lie back here. I'm going to pull this tray out. And listen to your heart. Alrighty, good. Now I'm just going to bend up your legs. I'm going to see if there's any pain. Does that hurt when I do that? Okay, does that hurt?
No, ma'am.
Okay, great. Now you can sit on up. Wonderful. All right, I'm going to have you go ahead and we're going to have a seat here by the desk and then let's talk, okay?
Just by way of introduction, I'm a board-certified dermatologist for the last 29 years. I practice in Cordova, Tennessee with Rheumatology and Dermatology, which is one of the oldest combined skin and joint offices in the United States. I did my medical school at the University of Chicago and then did my internship at Baptist Memorial in Memphis and my 3-year dermatology residency at Rush Presbyterian St. Luke's in Chicago. Thereafter, I practiced for 2 years in Rochester, New York, and I've been in Memphis over 28 years now. Welcome to Rheumatology and Dermatology, and thanks for listening.